So I go on your website and the first thing I see is the overall health of my patients is my main concern. And I'm thinking, well, wait a minute, you're not my primary physician, but dentistry these days is a lot more than I think we remember as growing up.
Back in dental school, it didn't make sense at the time, but they taught us you're the physicians of the oral cavity, and they drilled it in our heads wrong word, drilled it in our heads. They said, you know what? You are in charge of a person's overall health because you're the first practitioner that really sees warning signs of so many diseases that occur. And you're up and close with personal with patients every time you see them and meet them. So it's the truth. When I do an exam, when I first meet a patient, or when the patient comes in for an exam on every 6 months, we do a full check for oral cancer. I look at their face. I look at any moles that they might have on their face. Look at the color of their skin, the color of their oral cavity. You can tell a lot from the way a person's tongue looks, the way a person's lips look, whether they have vitamin deficiencies, whether they have diabetes. There are all sorts of warning signs that come in and around the oral cavity, and we see that and we know that.
So what was it that attracted you to dentistry in the first place?
Well, it was a long road. My dad was an OBGYN. He was a physician. I grew up always thinking I'm going to be a doctor of some kind. My dad was delivering babies every weekend. He worked like a dog, and I lived a good life. But I said, you know what? I want to be a doctor, but not his kind of doctor. And when I was in late high school and early college, moved into a neighborhood. My next door neighbor was a dentist, and on Saturdays he was washing his car. We lived in the same nice house, but I said, you know what? He's got a different kind of life, and it attracted me. And I worked in his office for a period of time as an assistant, as a cleanup person, learning and watching and seeing, and it made me go in the direction of dentistry.
Yeah. So obviously hundreds, thousands of patients over the years. What patient interactions stand out the most to you?
Well, I have patients that I've treated, that I've seen that have come in with just awful condition in their mouths. It's hard to even imagine that a person can go to 25, 30 years old in their lives, or even older, and come in with teeth that are black and literally black, looking like someone took charcoal to them. And not one tooth or two teeth, but many teeth or missing teeth. And there was this one woman that came in. She was in her mid-30s. She was an attractive woman, a little bit she appeared to be self-conscious, put on a good front, but she was really hurting inside, and the reason was she couldn't smile. And her passion was singing. So whenever she would go out and she would sing, she had to do it in a way that she'd have to hide her teeth. She didn't have a lot of money behind her, but we found a way to make things work for her. I gave her really a good break on everything, but I found a way to make things work in a way that would help her to do what she wanted. And the change in her life with the dentistry that we did was phenomenal. She ended up performing for a CD that was published locally, and she ended up singing locally in different venues, and it made her a different person. When she smiled, her soul came out, the warmth of her body and her self shined. And it's a gratifying thing to be able to make a change in someone's life, because we have the skills to do that. That's what we're trained to do, that's what we do, and that's the most gratifying thing that I do on an everyday basis.
So someone in the position that you just described finally says, you know, I need to find someone. What are they looking for when they set out to find a dentist? Because as you just said, dentistry today, the mouth is as you said, the pathway to overall health. So it's not such an easy decision anymore, maybe. They need to be looking for what when they set out to find someone?
Well, it's a difficult thing because people come, first of all, with all sorts of fears or preconceptions, or maybe they've had experiences in the past that make it difficult. And they also have needs and wants which may be reasonable, may be unreasonable. But usually people want one of three things. They want to look good, they want to be able to function properly, and they want to feel good about themselves as they function. They want things to be in a healthy state. So they might look at things and they might look in the mirror and say, I want a beautiful smile, I want to look like a movie star. I might look at their mouth and say, you know what, you need to be able to eat and to be healthy, and a part of that will be looking like a movie star. So a person has to first define what it is they're looking for. That being said, when they go to a dentist, they have to find someone who's actually going to listen to them, who's going to care about them, care about what it is that they are trying to say and they're trying to do. When that woman that I described before came in, I knew right away from watching her body language, from seeing how her eyes averted me when she was talking, but by seeing that she had a happy soul, something was happy about her, but something very sad. I knew where she was coming from. I knew her needs in her mind were to be able to smile, to be able to look great. But I knew her needs went far beyond that there was disease to deal with. So when a person comes in, I have to understand them. So the dentist that you go to has to have an understanding of what you need, has to have an understanding of what you can afford, because unfortunately, dentistry costs money, as many things in this world do. It doesn't come free, and it doesn't come free in terms of time, because it takes a commitment. So a person who's let their mouth go for a period of time, the dentist has to understand, why did this happen? Did they have a period of time when they were messed up on drugs, where they neglected themselves completely for one reason or another? Or do they have no means at all to deal with? So a dentist, in a way, has to be sort of an analyst, a psychiatrist, someone who's trying to understand. So the ideal dentist will be someone who understands you, who can take where you come from and put together a plan of action for you in a way that you can deal with. Insurance is an issue, because some people think, I have dental insurance and I can go right ahead and I can do what I want. But insurance, unfortunately, only pays a small portion of what a person needs. Care is important, because you can't just work on a person like you're working on a car, an inanimate object. The person has feelings. Some people are very sensitive. You touch their mouth and they are, it's the end of the world. They just shrink back when you go near them. Sure. So there's many, many factors, and the perfect dentist for someone, or the right dentist, is someone who will, I look at it as, treat you, or treat the patient the way that your family needs to be treated, the way I treat people, the way that I want to be treated, the way that I would want my wife or my daughter or my son to be treated when they're in the office. And with that as a starting point, if you have someone that you can sense you're connecting with, it's a good thing. After that come the skills. What does the dentist, has that dentist invested in terms of his or her education? I know that I've spent numerous hours in education. I belong to academies where education is a requirement, and there are levels of acknowledgement in these academies where the educational degree that you receive is commensurate with the amount of time that you spend. Not all dentists do the same things, or are interested in the same things, or have the same levels of skill. So it's not good enough that a dentist has a degree in school. Everybody, they have to have a degree, but that's the bare minimum. A dentist has to take education afterwards and continue to be a student in order to better provide.
Yeah, that was one of my questions about the specialties, but getting back to what you said about the fear factor, because speaking even for myself, I fall into that category. Had a bad experience as a young child, had a lot of things that went wrong, maybe for whatever the reason, got really jaded from it. And I'm sure you see that a lot. So what are the steps you have to take to get somebody through that, to show them, obviously, back to the benefits and why they need to see you every 6 months or 8, whatever it is? Because that fear, getting over that fear, and I can talk personally, that's a huge deal.
It's a big deal, and sometimes a person can't get over it. It's so deep and so fundamental to that person's either experience or their makeup that it's hard to get over.
But isn't convincing them that the technology, like every other thing, has evolved so greatly in your field as well, that it's not like tying the string around the teeth and slamming the door anymore? Isn't that part of it?
It ain't like it used to be. I mean, there have been major changes. When I went to dental school, I graduated dental school in 1983. So at that time, if I compare dentistry in '83 to dentistry today to what we're able to do, it's a totally different world. That being said, some dentists are still practicing as if it was 1980 in the 1980s and 1990s. The equipment's the same and the techniques are the same. So it's important when a patient comes into the office, I think if you go into an office where everything looks old and seedy and dusty and not up to date, that fear factor is elevated. So for me, a big part of it is to have equipment that's brand new, that's up to date, not only new, but technologically new and advanced. It gives a sense to start with for the patient, well, okay, maybe I'm in the right place because I feel a little comfortable with the types of things that I'm seeing here. This isn't my father's dentist. This isn't the dentistry that I went to as a child. The manner in which you're treated in the office, the way that you're spoken to, acknowledged by name, that you're cared for and concerned, that care and concern is shown for you by the front desk staff, even on the telephone, in accommodating you and accommodating your needs. If you ask for, if it seems like your neck is hurting, to give you a pillow, those types of things will make you feel, okay, maybe I can get over this innate fear. That being said, it's a difficult road, when the dentist has to acknowledge that. When I know a patient is fearful, and I can put my hand on their shoulder and say, listen, I understand where you're at. I understand, and I need you to let me know exactly how you want me to approach you, how you want me to deal with you. I can explain everything to you. We can go as far as pre-medicate you if you need. I can give you medicine to help you feel more relaxed when you come in. I'd prefer not to do that, but if you need that, we can do that. We have things that we can do, such as sweet air, which makes you feel a little happy and out of yourself a little bit, even though you're in full control of everything. So it calms you down, so we can do things like that. I can not show you instruments. I can tell you or not tell you. Some people want me to talk the whole time. Some people want me to shut up the whole time. I'll do either way. So there are manners that deal with it. They're giving you control. When you have a sense of control as to what's going on, if I say, you know what, I will get you completely numb, and I won't do anything, but if you feel anything, I need you to let me know. I'm so in tune with you that if you open your eyes just a little wider, I will know that you need me to stop. If you want to raise your hand, Donna is willing to hold your hand, my assistant, or Jessica, they often will hold the patient's hand, and the patient right away knows it, and they put their hand out to be held. That's all it takes, and so there's a levels of care. We can, at the worst end of the spectrum, or the most severe end of the spectrum of fear, we can actually have patients sedated and put them to sleep. There's some patients, very few, but some need to do that for cleaning. So there's a wide spectrum, but usually the majority of patients, I'd say 90% of patients, it's just the manner in which they're treated and the sense of comfort that they have in the office that gets them through everything. And then the other end of the spectrum is children that come in today. They love coming because it's a different world. Sure. And that makes a big difference for them.
That's all they know.
That's all
they
they know.
They don't get jaded because they have this new world. Let's go back to some of the specialties when someone's looking for someone, because there's dentistry, I guess, that focuses on specifics, and then there's general dentistry. So what should a person be thinking about as far as looking at specialty or general?
It's a funny thing, in New York, especially in this area, in the New York metropolitan area, everything is specialty driven because people have it in their brains and their minds that I have to go to a specialist, whether it's from peer pressure, my neighbor goes to a specialist, they go to the specialist, or just an understanding. Throughout the country as a whole, the majority of dentistry is done by general dentists. Every specialist is trained as a general dentist. That's where they start. Specialists go on to different training in a focused area. So there are 8 known specialties in dentistry. A general dentist is trained in every one of those areas. That being said, they may not like all those areas, or they may not be comfortable with pursuing work in certain areas, or they may not have had further training. I am a general dentist. I have pursued training in implant dentistry, and I've taught implant dentistry at NYU for a period of time. And I have trained beyond school to become expert in implant dental care. Implant dentistry, by the way, is not a specialty. It's just something that several specialties have taken on. So I am well trained to perform that. Not all general dentists are. I am well trained to do oral surgery of different types. So I extract teeth and I do different types of surgery because I pursued that training in many different ways, and I'm well trained. I'm well trained in terms of doing aesthetic dental work and in doing crowns and bridges and root canals. And all of these overlap different specialties. So the way I view it with my training and what I pursued and the way that I work in my practice is that I'm the quarterback. I'm the center, the hub of the wheel. And when a patient comes in, I will take responsibility for all of their care. And I know what I am either not qualified to do because I don't like to do it, or haven't pursued more training to do it. And that's where I personally will use a specialist. And like I've mentioned, there are areas that I've really pursued and that I am expert in. And so that I will do implants all day long. But when there are implant cases that go beyond what I should be doing or what I want to do, I will use either a periodontist or an oral surgeon to do that work. Now, every general dentist is different. So someone going to a general dentist has to be aware of the level of training that their dentist has, the level of educational pursuit that their dentist has taken beyond where they were trained initially, and how much of what they are proposing to do. So when a person comes in to look beautiful again because their mouth they don't feel is aesthetic anymore, there is no specialty in aesthetic dentistry, but there are people who have pursued higher levels of education in aesthetic dentistry. So the patient has to, there's no specialty to look for, but the patient has to ask their dentist, can you show me some pictures of what you've done? Can you let me know how many of these techniques you've done before? Don't be afraid to ask that question. The patient is the patient, and they should not feel funny asking their doctor, and their doctor should not be offended in answering such a question. And that's how I look at it. So the general dentist is the quarterback, capable of doing a wide range of treatments, but really that general dentist will quote unquote specialize or pursue certain areas of which they are most comfortable and most skilled at. And the other procedures that go beyond that will refer to doctors who are extremely well trained. Dentistry is amazing. Oral surgeons are amazing practitioners. I would trust an oral surgeon over many physicians in anything dealing with the head and neck area because of their training. Endodontists, root canal specialists might be a scary thing, but they do this all day long, every day of the week and every week of the year. And they are best trained for complications and difficulties with those types of problems, as periodontists are highly skilled in amazing amounts of work that can be done.
We talked about kids. Let's talk about the other end of the spectrum a little bit. The elderly. I'm assuming getting them to keep up is probably a job enough to get them in, but when they get in, what kind of special consideration do they need, and what do you do there?
They need a lot of special consideration, and I think as our population ages, we have children of elderly parents the children are 60 years old and their parents are now 85, 90 years old. And they say, oh, I got something to deal with on my hands, because now they have a parent, someone that they're caring for, or they're seeing as if this person was a child who isn't brushing properly any longer. Maybe has a medical condition where they're shaking and they don't have the motor skills, or they lack the eyesight, the ability to see properly. They lack the motivation. They're taking all sorts of medicines that cause problems. So there are a number of things that there is no specialty in dentistry for geriatric people, geriatric patients, but there are a number of conditions that occur. You know, geriatric patients come with a whole list of medical problems. They have hypertension, they have diabetes, they have history of cancer, they're taking medicines. Some patients bring in a sheet of paper that looks like a contract. It's a list of 20, 30 medications long, each of which have different interactions, and many of which affect the mouth, and some cause dry mouth, which many patients, elderly patients, deal with. When a patient's mouth is dry, their saliva doesn't lubricate properly, it holds food, it makes things sticky, they get more decay, there are different levels of acidity. So there's all sorts of things that we as dentists and caregivers have to recognize with an elderly patient, and also have to help the caregivers of these elderly patients to take care of. Maybe a grown child has to take care of their elderly parent's mouth by helping them to brush, by bringing them and making sure that they're coming to the dentist 2, 3, 4 times a year as they need to. That they're not in pain if they notice them eating in an uncomfortable way or avoiding certain foods, that they're astute enough to say, you know, are you having pain? Are you having a problem? Do you have to see a dentist on an emergency? These types of things are difficult, and we really didn't have the best training in school to deal with, and that came with further education and understanding, but it's a whole different realm. It's almost dealing with another group of children when you're dealing with patients as they get to different levels of their life. And I've had patients who've been, my oldest patient was 98 years old. I had a patient in their early 90s who I placed implants on because they were so vibrant and still looking to live life. And so there's no preconceptions I have. But there are many patients that they get Parkinson's disease and they're downhill, and it's a struggle to help them and to help their families maintain. And as a primary caregiver, which is a question you asked before, that we talked about, that's part of what we do.
Yeah. You've been doing this a long time. Talk to me about Bay Dental and what's your proudest moment, or what's your proudest thing about the practice right now?
Bay Dental was I had a practice in Huntington, which I recently sold. It was a practice that I grew. It was my baby, and I was there and I did that. I was attracted to this practice in Bayshore maybe 5 years ago, several years before I sold the Huntington practice, just because of the people that were there. They were, the Bayshore demographic is a different demographic. To me, I'm dealing with down-to-earth people. I'm dealing with dental needs that I didn't see when I was in the Huntington area. And I'm helping people in a different way, which is very, very gratifying to me. I'm taking smiles, of which I mentioned the patient before that I dealt with. That's more of a commonplace thing for me. And the challenges are how to help these people who have had different type of care, maybe minimal care, maybe different experiences that have made them prevent care, to bringing them into dentistry and to be able to be a caregiver and to have great experiences from it, to have people who look to me as a doctor, who actually trust what I have to say instead of look at me as if they saw it on TV, they saw it on the internet, they know more than me and they're going to tell me what to do. I don't mind that, and I understand that, but it's refreshing and it's gratifying to be able to take someone who is actually putting your trust, their trust in my hands, and I have that responsibility, and I'm able to carry it forward. Yeah. And I have many, many patients. That's my everyday in my Bayshore practice right now. I brought in, it was an older practice. I've rejuvenated it. I brought in brand new equipment, top of the line equipment, the most advanced technology that dentistry has. Where we can make a crown in an hour. Just before coming here, we made a crown in a CAD/CAM machine, a robotic digital impression and a robotic function that makes a crown that the patient would have to wait 2 weeks for. They can have it when they leave today. And I just did that before I came here. That's an everyday occurrence. I have lasers that I use for different things in the office. We have a three-dimensional imaging machine which helps me to diagnose when I'm doing implants. So I brought this technology into the practice and rejuvenated the practice and made it just something that I love to go to work to every day.
So I want to go back to insurance. Mm-hmm. So patients is thinking, how am I ever going to do this? How do they balance their health needs as far as what work they think they need or coming to see you to find out, against what the restrictions of their insurance are going to be? As you laid out before, insurance sometimes only covers a small portion. What do they do?
One of the most difficult things that I deal with on an everyday basis is the question of insurance. Patients have a misconception when it comes to dental insurance because it's not like medical insurance. Medical insurance can be such that it'll pay for everything, or the majority of things after you pay your deductible. In dentistry, I liken it to haircut insurance. It's almost like you get so much money and you pay so much money and it sort of pays for itself. An employer pays X amount of dollars and the patient only gets a little more than that back. A patient can't purchase their own dental insurance. So when it comes down to it, you get $1,000 a year, which hasn't changed since 1970 when insurance first came out. $1,000 in dentistry doesn't buy a lot. So a patient says, I have insurance, do whatever you want. And I said, well, it'll pay for 1/10 of what you need. It's a hard thing. So the first thing, I have to help patients understand that this is their health they're dealing with. You don't want to, you can't skimp on it. Now, we don't have to do things in the most ideal, and I don't want to say in the wrong way, but in the Cadillac way. You can approach things in different ways. You could phase treatment in different ways. But there's a way of looking at and maximizing insurance so I can help you as a patient get the most out of your $1,000 or $1,500 benefit for the year. But I have to help you to understand that you have to value your health. You have to value that tooth, that you don't want to lose that tooth. It's not just a tooth, because you lose one tooth, you lose another. Pretty soon you're smiling and there are holes in your mouth and you can't chew properly and you can't digest your food properly and all sorts of things happen. So I have to help you understand that, you know what, it doesn't pay for it, but insurance shouldn't be your reason or your means of deciding on your care. Sometimes you'll have to put your money in your pocket, like you do when you go to a fine restaurant versus going to a fast food place. You make a decision to spend $100 on dinner instead of $5 on dinner. So you have to understand that you'll have to make a decision to keep your health to a certain level, and that's my job to help you. So it's an educational process, but it's also helping to work within your means and to make care affordable. What we did in our practice is we've put forward a program. It's not insurance, but it's a contract program. It's a program where you become a member of Bay Dental Health's care group. So we have patients pay a certain amount of dollar per year, very low entrance fee, and then on a monthly basis, a small monthly payment, which gets them work at no charge, such as cleanings and exams and things like that over the year, at no additional charge. And then on top of that, they have a 20% or so courtesy off of regular fees. So it's almost like a 20% insurance plan, even though it's not insurance, but that's self-administered by our practice. And we work with other things that help make care affordable. So really what it comes down to is taking the insurance thing and making it into an affordability and something that a person can budget in terms of doing and working with over time.
Let's just talk about general care for the basic customer who would be watching this, and they say, well, I can just come once a year. That's really enough, right? And you say what?
It's not enough. You know, it was funny. Today I had a patient come in on an emergency. He was here vacationing with relatives from Italy. And the guy was in his 40s. He came in and he had a bad toothache, and I looked in his mouth and I swear he hasn't had a cleaning since who knows if he ever did. You know, it's not what we're used to seeing in America. We're used to seeing patients programmed to come in twice a year. And the benefit is that when you see a patient, when a patient comes in twice a year, problems are minimal. They have their teeth cleaned, so they have fewer gum problems. Because when a person is 20, they might not think it's such a big deal, but when they're 40 and they start getting loose teeth and losing teeth because of gum disease, which could have been prevented, that's prevented by being seen twice a year. So do you really have to come in twice a year? No, I prefer to see you twice. Some patients I have 4 times a year because their needs, they just can't deal with the load, the bacterial load and the problems that occur every 6 months. So they have to come in every 4 months or every 3 months. But for the average person, twice a year is necessary. You don't need x-rays every time you come in. Maybe once every 2 years you have x-rays, unless you have a high need for a high caries index or a cavity proneness, that type of thing. But you should come in twice a year. And in doing so, I can keep your problems minimal. I can keep you from having crowns and do small fillings instead, or I can keep you having from tooth loss and needing implants and maintain your teeth and help your gums to be healthy, the bone holding the gums to be healthy, and the teeth free from decay.
Well, it's great stuff, Dr. Antenucci. Great to be with you.
My pleasure.
Bay Dental in Bayshore, New York. Thanks for being here.
Thank you so much.